Graves' disease. What is it? It is an autoimmune disorder in which there is an overproduction of thyroid hormones. This is a chronic condition that requires long-term care. It is the most common type of hyperthyroidism. So who is at risk for this disease? People with the family history are at risk for this disease. Women are at a higher risk than men are. It is usually in people under the age of 40. Higher risk is also in those with other autoimmune disorders such as type 1 diabetes or rheumatoid arthritis. People who are already genetically susceptible to this disease are at higher risk when they are emotionally or physically stressed. Also, people who are more genetically susceptible to this disease increase their risk during pregnancy. Smoking is another risk factor of this disease. What are the signs and symptoms? Signs and symptoms include, but are not limited to, anxiety, irritability, fine tremors of the hands and fingers, heat sensitivity, an increase in perspiration, or warm, moist skin, weight loss despite normal eating habits, enlargement of the thyroid gland, change in the menstrual cycle, reduced libido, frequent bowel movements, bulging eyes, thickened skin of the shins and top of the feet, rapid or irregular heartbeat, also known as palpitations. Now let's talk about treatment. Beta blockers such as propranolol help treat the symptoms of Graves' disease. This medication blocks the effects of hormones on the body. It provides rapid relief of irregular heartbeat, tremors, anxiety, irritability, heat intolerance, sweating, diarrhea, and muscle weakness. Side effects of this drug may include fatigue, worsening weakness, worsening anxiety, dizziness, depression, and nervousness. You should notify your doctor immediately of excessive fatigue and depression. You should take this medication as directed at the same time each day. Never abruptly stop taking this drug, as it could have life-threatening effects on the body. It is important to check your pulse every day and your blood pressure at least twice a week. You should notify your doctor if your pulse is less than 50 or if you have significant blood pressure changes. Another treatment for Graves' disease are antithyroid agents such as methimazole. These decrease the signs and symptoms of hyperthyroidism by inhibiting the synthesis of thyroid hormones. Side effects of this medication may include rash, drowsiness, headache, and diarrhea. You should also take this medication exactly as directed. You should check your weight 2 to 3 times a week and notify your doctor of any significant changes. Since this causes drowsiness, you shouldn't drive until you know exactly how it affects you. You should also report fever, chills, yellowing of the eyes or skin, unusual bleeding or bruising to your doctor immediately. The goal with treatment in this is to inhibit the overproduction of thyroid hormones and lessen the severity of symptoms. However, there can still be periods of remission and exacerbation regardless of the treatment. And that concludes this video. I hope I answered all your questions regarding Graves' disease and the treatment. Thank you for watching.